that you're just in time to join us for Straight Talk, where you get nothing but straight talk from our expert panelists and our host, Dr. Straight. And here he is.
Hi, I'm Dr. Straight. Welcome back to Straight Talk. Last time we were together, we tried a new segment called Man on the Street. So we're going to keep going with that. We got a lot of positive feedback. Thank you for that. Let's go on to our first question.
Dr. Straight, I have a question. How often should staff or patients wash their hands?
Wow, what a perfect question leading into the holidays and with flu season upon us. You know, as healthcare providers, we're trained how and when to wash our hands. And as an organization, we actually grade ourselves on how well we do with hand washing, because we know it's probably the single most important thing we can do to prevent infection. But it's important for you too, for two reasons. One is it can keep you from getting sick, and the other is it can keep you from spreading germs to others, especially around this time of the flu season. In fact, we have stations at the entrances that include hand sanitizer and a mask if you need it for visitors or patients who come to visit us. So when should you wash your hands? Well, most of this stuff you probably learned in kindergarten, but certainly before you eat or preparing your food. Whenever you are caring for someone who's sick or maybe taking care of a cut or a wound of some kind. Certainly if you were to cough or sneeze, that's a good time to wash. The other thing is when you come into contact with anything contaminated. So what we're talking about is fomites, or objects that can carry viruses or bacteria that have the possibility to make you sick. So think about that the next time you're grabbing a door handle at the airport or riding up an escalator and touching the handrail. But what about the things that we carry with us every day, like our cell phone? In fact, recently we did a demonstration at a health fair that talked about how dirty or clean our cell phones are. So let's go to the medical mall and see what they're up to.
This is a little device that we use throughout the hospital to test to see how dirty or clean the environment is.
Show me how it's done.
So just the screen on the sides where you touch it a lot, maybe on the back. This usually will take about 15 seconds. It's very quick. 15 seconds, anything under 100, you can consider it pretty well clean. Anything over 100, then we encourage you to clean. So 38, your phone is 38, it's not bad.
Not as bad as I was expecting.
All. Right, and if you think about where you take your phone, you're always touching your phone.
On it.
Are your hands clean? I mean, everybody always has their phone in their hands,
Yes.
right? So that's pretty good. Yours is a 38.
All right, let's see if we can kill them all.
All right. And then we have to let it dry.
Little crevices here.
Right. Okay, so it's going to take 15 seconds just like it did before. Let's see what happens.
Wow, look
One.
at that.
Wow.
So you were, what, at 38?
38,
So one.
yeah.
Very good.
Now it's decontaminated.
So you can tell it actually works.
Really neat.
Yeah, very good. Your phone is good to go.
It's good to go.
Hey, thanks Robin. Great information. Let's go on to question number 2.
Hey, Dr. Straight. I do a lot of cooking around the holidays. What proper precautions should I take in order to keep my family safe during the holidays?
So that's a great question. Food handling errors and inadequate cooking are major problems for foodborne illness in the United States, and working with poultry can be especially tricky. Especially around the holiday time frame, we should take some extra precautions to make sure our family's safe. Even though it's better to give than receive, it's never good to give or receive food poisoning. So for today, we have a special guest. One of our head chefs is here to share with us some special advice and tips while working in the kitchen.
To check the doneness of your meat, you need proper food thermometer. And you would stick it into the thickest part of the chicken or the turkey, or poultry if you want to say that, and you'd stick it into the thickest part to check the temperature, and it should read 165 for doneness in poultry. After you've temped your chicken or cut your chicken or your turkey, you should always clean your surfaces before cutting anything else, say from meats to vegetables or fruits or anything like that, some totally different item. Wipe down your cutting board. Very good, so you don't cross-contaminate. Wipe off your thermometer as well. And your knife, if you've used your knife, you just wipe it off, wipe everything off. Hot soapy water is good. And that way you prevent cross-contamination.
Great, thanks Chef for the helpful tips. That's all the time we have for today. Thanks for joining us. We'll see you next time on Straight Talk.
I always want to remind everyone that what you don't know can hurt you.